Hey everyone!
Hi, happy Saturday everybody. We wanted to introduce you to a new web series we're starting here at Pediatric Care called Paging Dr. Fuller. We are trying to educate our Google moms and kind of start some open communication and personal communication with our patients. So Dr. Fuller, one thing that as a mom I've been hearing a lot about is the epidemic spread of measles. 23 states in the U.S. have experienced the measles. So as a mom, as a parent, what do I need to understand about measles?
So I think really everyone needs to know what measles is. So it usually starts with high fever, 103 or above. You also get cough, coryza, which is runny nose, and conjunctivitis, which is red watery eyes. So it often looks a lot like a cold to begin with. One other thing that shows up is Koplik spots. So these little bumps you get in your mouth are usually white to gray, bluish in color. And then you also get a red rash, usually starts on the face, spreads downward, starting at like 3 to 5 days after the fever.
So I could see symptoms as early as a few days, and it would look similar to just a virus.
Yeah, it really does imitate a lot of other viruses.
So as a parent, if I have concerns about illness, sometimes it's worth getting checked out by my pediatrician.
Definitely.
So how does measles spread?
So measles is actually one of the most infectious diseases out there. Just in a room of people, 90% of people who are unimmunized would get it from someone else if they breathe the same air.
So that's why they're calling it epidemic, because it's so quickly spreading.
It does spread very quickly.
And very easily. So how do I protect my child? What's the best way to keep my child safe?
So the best way to protect your child is to get them immunized. So you get a shot at age 1, you get a shot at age 4 before kindergarten.
So if I'm one of the moms that doesn't want to vaccinate, or I'm on a different vaccination schedule, is there any precautions I can take to avoid the measles for my family?
Yeah, I think the best thing you can do is just avoid places where there's large crowds, avoid people who are sick, and particularly those states that are having large outbreaks.
So postpone the Disney trip this year, at least until the spread of measles has been contained. All right, well, thank you, Dr. Fuller, for the information. I know you're wanting to hear more from patients, so how can we communicate with you?
Yeah, if you guys want to message us on Facebook or Instagram, we'd love to answer more of your questions. So just let us know what you want to hear. Thanks.
Awesome. Well, thank you, guys. Have a great rest of your weekend.